What are extraocular muscles? If you split the term, it will give you the meaning. Extraocular. So these are the muscles which are present outside the eyeball. There are muscles which are present inside the eyeball which are referred to as intraocular muscles. In the topic of intraocular muscles, we have already discussed about sphincter pupillae, dilator pupillae and ciliaris. These are referred to as intraocular muscles because they are present inside the eyeball. Since these muscles are attached outside the eyeball, we refer it to as extraocular muscles. They are essential for moving the eyeball. Right? Now, these extraocular muscles are classified. They are divided into groups. What groups? The extraocular muscles can be grouped broadly as voluntary muscles. We can group it as voluntary muscles and involuntary muscles. Right? Involuntary muscles are smooth muscles. Right? They are unstriped muscles, whereas voluntary muscles are striped muscles. Now, voluntary muscles include 1. Recti. Okay? Then it includes obliques. And finally, it includes levator palpebrae superioris, commonly referred to as LPS. There are 4 recti. These are superior rectus, inferior rectus, medial rectus and lateral rectus. Right? Then obliques are 2, superior oblique and inferior oblique. And there is 1 levator palpebrae superioris. So there are 7 voluntary extraocular muscles. When we come to involuntary muscles, the involuntary muscles are superior tarsal muscle, then we have inferior tarsal muscle, and then the third is orbitalis. Right? There are how many muscles? 3 involuntary muscles. So there are about 10 extraocular muscles and we'll focus in detail on each of them. Right? Let's begin with the discussion of recti. The rectus muscles are 4 in number as we mentioned. We'll identify this. This is the superior rectus. Then we have the inferior rectus. Let's say this is the medial rectus. And finally, we have the lateral rectus. Right? So there are 4 recti. All recti take their origin from a common origin. Now, what is that? All recti have origin from a tendinous ring of Zinn. It arises from where? The tendinous ring of Zinn. We have already seen this in the topic of superior orbital fissure. Right? So they have a common origin. What about insertion? If you observe, the insertion of recti is into the eyeball, into sclera. Right? So where is the insertion? Insertion is into sclera. But what we need to know is, it is inserted at a distance from limbus. Now what is limbus? Limbus refers to this area of junction between the sclera and cornea. So what is this? This is the limbus. So insertion of recti is into the sclera at a distance from limbus, and this distance is very peculiar. For example, let's imagine this is the medial rectus, this is the inferior rectus, here we have the lateral rectus and this is superior rectus. What about this distance? Now this is about 5 mm from the limbus. Okay? Then this is about 6 mm. Right? Then this distance is about 7 and 8 mm respectively. So you can remember this easily. All you need to do is, you need to go in a clockwise direction and increasing the distance by 1 mm each. Right? Simple, right? So medial rectus is attached or inserted at a distance of 5 mm from the sclerocorneal junction or the limbus. Then 6 mm is the attachment of inferior rectus. Lateral rectus is attached about 7 mm from the limbus, and superior rectus is attached 8 mm from the limbus. All of them are ultimately inserted into one common point, that is sclera. The other important thing you need to remember regarding the insertion is all extraocular muscles are inserted in front of the equator. If you pass a line along the equator of the eyeball, all recti are attached in front of the equator. This is important because we can see obliques, and we will discuss it in detail further. The obliques are attached posterior to the equator, right? We need to understand this peculiar attachment because the actions of recti and the obliques slightly differ. So remember, recti inserted in front of the equator, obliques inserted behind the equator into the sclera. This is regarding the four recti. Let's focus on the obliques now. There are two obliques. What are they? This is the superior oblique, and here we have the inferior oblique. Right? What about the attachment of these obliques? If you observe the origin of superior oblique, it is coming from the under surface of the lesser wing of sphenoid. That is the origin. Where is the insertion? The insertion is into posterior part of sclera behind the equator. Right? This is regarding the attachments of superior oblique. What about the inferior oblique? Inferior oblique, if you observe, is taking its origin from the under surface or the orbital surface of the maxilla. So from the maxilla, the muscle passes posteriorly and again gets inserted into posterior part of the sclera behind the equator. Right? So remember this, even in your exam, you need to mention this. For attachment of recti, it is in front of the equator. For obliques, it is behind the equator or posterior to the equator. This is regarding the attachment of obliques. Before we discuss about action of these muscles, recti and obliques, we need to know regarding their nerve supply. Now, nerve supply of the extraocular muscles can be easily remembered by a mnemonic which goes like this: LR6, SO4 and rest by 3. What do we mean by this? Lateral rectus is supplied by the 6th cranial nerve or abducent nerve. Superior oblique is supplied by the 4th cranial nerve or trochlear nerve. And then we have all other muscles. Let it be the medial rectus, inferior rectus, superior rectus, or even levator palpebrae superioris. All are supplied by 3rd cranial nerve, that is oculomotor nerve. So please remember this mnemonic to remember the innervation of the extraocular muscles. This is regarding the innervation of extraocular muscles. What about the actions then? In order to understand the actions, we will write a simple diagram, right? Let's imagine this is the eyeball, right? This is the eyeball, and for understanding, we'll write this as the nose. So we have drawn the right eyeball, right? So let's see the actions. First, we'll write the muscles: medial rectus, then inferior rectus, then lateral rectus, and we'll write superior rectus. The direction of the arrows are actually telling about the actions of all these muscles. What do I mean by this? The medial rectus will pull the eyeball towards the nose. The movement is referred to as adduction. Right? It is referred to as adduction. If it is moving away from the nose, it is referred to as abduction. So remember, when we talk about lateral rectus, the only action is abduction. When we talk about medial rectus, the only action is what? Adduction. But for superior rectus and inferior rectus, it is slightly different. That is, it will bring about upward movement of the eyeball. What do you call this? This is referred to as elevation. Right? Along with this, superior rectus can also bring about the adduction, right? So it can bring about adduction. In addition, it can rotate the eyeball towards the nose, and this movement is referred to as intorsion, right? This is referred to as intorsion. Done? So, action of medial rectus and lateral rectus are only one. It is adduction and abduction. But superior rectus, if we observe, it can cause elevation, then adduction and also intorsion. Let's learn about inferior rectus now. Inferior rectus brings about depression of the eyeball. Okay? So, we call this movement as depression. Then, it can bring about adduction. It can also bring about one more rotatory movement. Now this movement, remember, is opposite to intorsion. So what do you call this? You call this movement as extorsion. The outward rotation of the eyeball is what we refer to as extorsion. This is regarding the actions of recti. The actions of obliques are slightly different, right? Remember, the elevation of the eyeball is brought about by inferior oblique, not superior oblique. Similarly, the depression of the eyeball is brought about by superior oblique. So please remember this. The obliques have exact opposite action to those of superior and inferior recti. Let's try to learn more about the actions of these obliques. The inferior oblique, as we have already learned, will bring about what? It will bring about elevation of the eyeball. Then, along with elevation, it can bring about abduction. Right? Then, it can bring about extorsion, the outward rotation of the eyeball. Similarly, the superior oblique brings about depression. Then, it can bring about abduction and it can bring about intorsion. This is how you can easily remember the actions of extraocular muscles. For example, if I ask you, what are the actions produced by medial rectus? Now, can you look at the image and tell me what actions are produced by medial rectus? We can see only one action. That is, it is bringing about what? Adduction of the eyeball. Then, if I ask you, tell me the actions of superior rectus. If you just observe the image, the superior rectus is bringing about three movements. What are they? It can bring about what? Elevation. Then it can bring about adduction and it can bring about what? Intorsion. Right? If I ask you about the actions of superior oblique. Now observe the actions of superior oblique. It can bring about what? Depression of the eyeball. Then it can bring about abduction. Then it can bring about intorsion. Right? If you remember this one important diagram and if you know how to draw this diagram, the muscles and actions of these muscles of the eyeball become very clear and very easy. You need not mug up the actions, just remember this diagram. Right? This is regarding the detailed actions of the recti and the obliques. One more extraocular muscle that we have is levator palpebrae superioris. Now, before we identify the attachments, let's try to get orientation of this image. This side is the roof of the orbit. This is the roof of the orbit. Then, this is the floor of the orbit. We have just used an inverted image to make you understand the relation between the levator palpebrae superioris and the superior rectus muscle. Right? Now, let's try to identify these muscles. This is the levator palpebrae superioris and this is the superior rectus. So, levator palpebrae superioris lies superficial or covers the superior rectus muscle. The levator palpebrae superioris takes its origin from the roof of the orbit. The insertion is what? Slightly peculiar. Now, if you observe close to its insertion, it splits into multiple lamellae. Right? These lamella are referred to as superior, intermediate and inferior. For example, these are the superior lamella and these are the intermediate lamella and then we have the inferior lamella. Fine. The superior lamella is attached to the superior tarsus superior tarsus of eyelid. Then what about intermediate lamella? The intermediate lamella is peculiar because it is giving origin to few of the muscle fibers, and these muscle fibers are referred to as the superior tarsal muscles. So remember, superior tarsal muscles are derived from intermediate lamella of levator palpebrae superioris. Then what about the inferior lamella? The inferior lamella, as we can observe, is attached to the superior fornix of conjunctiva. This is regarding the attachments of the levator palpebrae superioris. You need to focus more on attachment of the recti and oblique, but even in case of levator palpebrae superioris, at least these important attachment points you should remember. Right? What about the nerve supply? We have already learnt about the mnemonic LR6, SO4 and rest by 3. So even levator palpebrae superioris is supplied by, so what is its innervation? It is by the third cranial nerve or oculomotor nerve. What about the actions? If you split the name of the muscle, you get to know the action. Levator, elevation, palpebrae, eyelid, superioris refers to upper eyelid. So in simple terms, it brings about what? It brings about elevation of the upper eyelid. Right? So opening of the eyes or elevation of the upper eyelid is brought about by levator palpebrae superioris. Can you tell me which muscle will help in closure of the eyelids then? Yes, it is the orbicularis oculi. And what is the innervation of orbicularis oculi? It's a muscle of facial expression and hence it is supplied by facial nerve. Right? So never confuse orbicularis oculi with levator palpebrae superioris. LPS results in elevation or opening of the eyelids, whereas orbicularis oculi will result in closure of the eyelids. This is regarding the levator palpebrae superioris. Then let's discuss a little bit about the involuntary muscles. The involuntary muscles are 3 in number. As we said, these are the superior tarsal muscle. Then we have the inferior tarsal. And finally, we have orbitalis. Let's try to identify these muscles first. Right? Now here we have the superior tarsal. Then here we have the inferior tarsal. Orbitalis cannot be seen because it is present below the inferior tarsal muscle. The superior tarsal, as we have already discussed, arises from the intermediate lamella of the levator palpebrae superioris. It arises from intermediate lamella of levator palpebrae superioris, and the inferior tarsal is a muscle which connects the inferior oblique and inferior rectus to the facial sheath of the eyeball. This is in brief regarding the involuntary muscles. You need not worry too much about the attachment, innervations or action of these involuntary muscles. Always focus on the extraocular muscles which are voluntary. The 4 recti, the 2 obliques and 1 levator palpebrae superioris. Right? Once we have learned the details